Thank you. We all get on so well. Everybody's having a wonderful chat. So thank you very much to all of you for joining us, and welcome to Vienna and the wonderful Vienna International Centre. I'd first of all like to say thank you to the Imperial Classic Orchestra, who have performed for us and will be doing so again with a singer in the break. I'm sure you all agree that the music was beautiful, and we're very lucky to have the opportunity to hear it again. But interestingly, I was told that this is the first time that live music has been performed in this conference area, so we feel very privileged to have claimed that first. So, first of all, I'm very used as somebody from the UK to saying to people, thank you for braving the weather. In my context, that is normally the cold and the rain, but here we say thank you very much for braving this heat, which, as I understand, will disappear tomorrow and we will all be back to our normal climate. But thank you very much for joining us. It really is appreciated, and it's wonderful to see you all here today. I am Joanna Travis-Roberts, and I have the privilege and the honour of leading ISSUP and welcoming you all here today and opening this fantastic event. It really is, as I said, an honour to stand here. We have a series of esteemed speakers who will be opening and welcoming you, as well as many varied and interesting programs throughout the week, as well as a variety of trainings and side meetings that will be taking place. We hope that they will be enjoyed by around 600 participants from 123 countries, so it really is impressive. I agree, it's impressive. ISSUP's vision is a connected, knowledgeable, and effective international network of prevention, treatment, and recovery professionals, and that those professionals are undertaking and promoting high-quality, evidence-based, and ethical prevention, treatment, and recovery care. In order to achieve this mission, we work in three ways. We have a digital presence, which is our website, our social media, and our email newsletters, which I hope that many of you are already using and enjoying. We have our national chapters, and we have a meeting taking place with representatives from 19 countries this week. So that continues to develop as we have our presence on the ground, a local presence in countries. We also have these events, and we're very lucky to be making our way around the world. We've been to Thailand, Brazil, Mexico. Last year we were in Kenya, and here we are now in Austria, in Vienna, and very pleased to be here. This event is incredibly exciting for ISSUP. It's really very special to be here, as I'm sure you would all agree, in this presence hosted by our partners, UNODC. It's also fantastic to be joined by the training partners who are here. We have CCAD, OAS, Colombo Plan, CADCA, EMCDDA, UNODC, WHO, the Drug Free America Foundation, the International Consortium of Universities for Drug Demand Reduction, and NADAC. So we really have a variety of people here joining us to enrich the week. I'd like to thank UNODC for collaborating with us and for hosting us. It's really been a fantastic process to work together with them, with our colleagues here, and we hope that the strengths of both of our organisations will come together to contribute to such a successful week. These events are really ISSUP's opportunity to be face-to-face with you, the workforce, the people that are understanding this field from your own on-the-ground and individual perspectives. We are able to share knowledge, increase capacity, hold side meetings, and work together. And we hope that this week allows us to continue our existing collaboration and build new ones. I think you will all agree the atmosphere in the room this morning was like a family reunion. Lots of people have said the same thing to me. And it's so good to be coming together with people that we already know, that we already work with, and to build new collaborations, new relationships, new exciting developments. We really hope that this week together will allow each of us to better understand another's viewpoint or perspective. We're all here because we want to reduce drug demand. We know that there are approaches that can and do work to do that. We have in our midst individuals and organisations that are going to share that knowledge, and we want to learn from it and also be able to share our own experiences. The theme for this year's event is inspiration and direction, which is a very aspirational concept, which I hope that we are achieving. But I'm already inspired to be standing here in front of a room full of very busy, very committed, very dedicated people who have taken time away from their work and family lives to join us here. I'm inspired by the organisations that are delivering trainings and holding meetings. I'm inspired by the presenters that are speaking and holding poster sessions downstairs. But as the title suggests, we're not here just for inspiration. It's about direction. And I invite you all to take that one extra step, one step further, to put the learning or the connections that you make into action and ensure that everything that we do, that we learn, that we discuss this week filters its way back into your practice so that the impact is actually felt by your target groups and within your settings. We've come from a range of locations and haven't yet worked out who's travelled the furthest, but I have 3 days to talk to lots of people, so maybe by Wednesday I'll get back to you to award the person who had the most arduous journey. But many of you have had arduous journeys, and many of you have had shorter journeys, but we appreciate the effort that everybody has made to come here together. We're from a range of locations, but also a range of professions, a range of cultures, and a variety of perspectives. But here we are, all in one place, working together, bringing that identity in one place, despite our various different outlooks and approaches. I would love to think that this week, perhaps a policymaker is going to learn something from a practitioner. Perhaps next week a practitioner is going to put into their day-to-day work something that they learned from a researcher. Maybe a conversation over coffee will lead to a collaboration, but all of these exchanges will lead to better understanding of each other's situations, perspectives, and approaches. Our field, as I said, is a family. We have the same vision. We're working in different ways to achieve it, and the more that we are able to meet, share, collaborate, exchange, and really have our work embedded in that evidence that we are all here to discuss and learn, the more we can do and the greater impact we can have with that work that we are doing. So, as I said, we are the ones that are lucky enough to be here together in one room, but there are others outside who are joining us by social media or connecting with colleagues that are here, so we urge you to keep posting and sharing about the event and your experiences on your own social media, but also on the ISSUP website's networks. I'd like to extend one last thank you to the US State Department, without whose support, really none of this would be at all possible. So, I'm to tell you that there is simultaneous Russian translation taking place if you wish to access that. Now I will leave you to hear our welcoming and opening remarks from the panel. And I will pass the floor over to our first speaker and indeed our gracious host to give his welcome remarks, Mr. Yuri Fedotov, Executive Director of the United Nations Office on Crime, Drugs and Crime.
Thank you, Madam Chair. Distinguished participants, ladies and gentlemen, I welcome all of you to the Vienna International Center. And we are so pleased to host you very representative and very timely and important conference at the UN headquarters in Vienna. That is actually one of the largest conference rooms of the Vienna International Center. Usually the commissions, both commissions, Commission on Narcotic Drugs and Commission on Crime Prevention and Criminal Justice are having their meetings in this particular room. And your meeting is also very relevant as a sort of a follow-up to the recent session of the Drug Commission in March, where member states in a ministerial declaration have reconfirmed the balanced approach focused on health, rights, and justice. Over the years, the International Society of Substance Use Professionals have been an important partner in the work of UNODC to support high-quality, evidence-based prevention and treatment of drug use disorders. You provide a much-needed platform for exchange and in this way contribute to development of a well-trained and knowledge international network of experts. The need to promote the training of personnel in the treatment, aftercare, rehabilitation, and social integration of drug use disorders is a high priority of the international drug control framework. Governments have followed up with numerous resolutions emphasizing the importance of trained and qualified service providers and of supporting mechanisms to ensure that policies can be informed by science and clinical experience and practice. This, of course, includes strengthening cooperation with the scientific community. Ladies and gentlemen, just last week we launched the 2019 World Drug Report on the International Day Against Drug Abuse and Illicit Trafficking. The theme of this year's International Day is Health for Justice, Justice for Health, emphasizing the importance of health and social services working hand in hand with accountable and inclusive institutions of criminal justice to address global drug challenges. Health and justice are among key objectives of the Sustainable Development Goals. Preventing and addressing drug problems are essential to delivering to this promise. Our report shows that some 35 million people are suffering from drug use disorders. More than 500,000 people, most of them young men and women, are dying from the drug use every year. There is a clear need to redouble efforts to advance evidence and human right-based responses to drugs, as called by the Convention, especially we need to focus on developing countries. I very much welcome UNODC's partnership with you to support such efforts to protect people and ensure that we leave no one behind. And we're doing this through our global programs as well as our regional and country programs through the network of our field offices in more than 60 countries in the world. And I very much welcome the continued partnership with you to protect people. It goes without saying that in turn you can always count on UNODC support. Welcome once again to Vienna. Of course you came here during the heat wave. It's a global warming, nothing to do, but I hope you are comfortable, that the conference service provided to you will be good, excellent, and you will enjoy this week in Vienna. And I wish you very productive, very resultative discussions. I thank you.
Thank you very much. Now we'll be hearing from Ambassador Walcott. She's the US Permanent Representative to the Vienna office of the United Nations.
Thank you, Joanna, for the kind introduction, and thank you, Executive Director Fedotov, for hosting us, and for the excellent work of UNODC staff in organizing the week's events. And since I have you right here, I was thinking maybe conference services could start putting orchestras and flowers in all of our meetings. It would make them so much nicer here in the Vic.
It will be done.
Thank you. I'd also like to express appreciation to Dr. Franz Pitz of Austria's Federal Ministry of Labor, Social Affairs, Health, and Consumer Protection for your support and that of your ministry. It's a pleasure to be here with all of you and with our colleagues from the United Nations, the Colombo Plan, World Health Organization, African Union, the OAS, the European Monitoring Center for Drugs and Drug Addiction, as well as partners from the Community Anti-Drug Coalitions of America and Drug Free America Foundation. I would also like to recognize the audience here. Look around you. This is a distinguished group composed of participants from more than 120 countries, all of whom have dedicated their professional lives to preventing and treating those with substance use disorders. Thank you for the critical work that you do, and could we give them a round of applause too, please? In the United States, we are suffering through a drug use epidemic of unprecedented scale, and the issues that will be discussed over the course of the next several days are extremely relevant to the challenges we face at home and the issues our partner countries confront around the world. According to the just released UN World Drug Report, 585,000 people died due to drug use in 2017. That is simply unacceptable, and we thank you all for your work to combat the scourge through effective, evidence-based prevention, treatment, and recovery. We know that substance use disorders are preventable, that treatment is effective, and sustained recovery is possible. ISSUP brings together people from many disciplines: health workers, educators, administrators, researchers, community leaders, and policymakers. It is when we combine all our skills, experience, and knowledge that we can tackle this challenge in a meaningful and lasting way. You've come to Vienna to exchange expertise, conduct and engage in training, network with peers who grapple with and solve similar challenges around the world. And this event brings together the top international experts in the field. I hope you get to know one another and share all your experiences. And when you get home, I also hope you continue to look for opportunities to promote drug prevention and treatment in your communities and countries. On behalf of the United States government, I want you to know how proud we are to partner with all of you and to support the work you do. We look forward to sustaining our existing partnerships and fostering new ones over the next few days and bring to our learning to bear to tackle this global challenge. We thank you for your time, your energy, and the passion you put for these issues across the world. Thank you very much.
Thank you very much. We will now be hearing from Dr. Franz Pitz on behalf of our host country, Austria. He's the Deputy Director General, the Head of Department for International Affairs of Addictions, the Federal Ministry of Labour, Social Affairs, Health and Consumer Protection.
Thank you, Madam Chair. Excellency, Mrs. Ambassador Walcott, Executive Director, Mr. Fedotov, Executive Director of ISSUP, Ms. Travis-Roberts, Joanna, distinguished ambassadors, honorable high-level speakers, dear ladies and gentlemen, distinguished guests, willkommen in Wien. On behalf of the Federal Minister of Health, Dr. Brigitte Zafel, who unfortunately cannot be here today, as we are in the last parliamentary week before Parliament will be dissolved due to the upcoming elections in September this year, I cordially and warmly welcome you to the beautiful city of Vienna. It is truly a pleasure and underlines the importance of this conference subject to see such a large number of participants from over 120 countries here today. This is also an excellent occasion to prove the strong heartbeat that goes out from Vienna, one of the headquarters of the United Nations and definitely the UN hub when it comes to the sensitive topic of drugs and drug addiction. I particularly welcome the International Society of Substance User Professionals, ISSUP, to have chosen Vienna for its 5th annual meeting, its first in Europe. Much has been achieved, but challenges still persist. The world drug problem remains a complex challenge to the health and well-being of humankind. It poses a major threat to human dignity, safety, as well as international security and development. I particularly commend ISSUP for its role to serve as a focal point for international cooperation and the sharing of best practices in the field of substance use, treatment, and recovery. ISSUP certainly helps to provide a valuable platform for a multidisciplinary exchange of professionals in this field. The format of this conference, with over 11 sessions, with around 50 presentations accompanied by a significant number of training workshops, is an excellent opportunity to allow all of us, by interactively participating, to gain new knowledge and get the chance to look beyond our own nose into other disciplines. This focus on science and evidence allows us to address critical issues apart from ideological controversies and political disputes. In this regard, Austria stands ready to offer its experience and best practices, including also in risk and harm reduction measures, such as maintenance therapy, needle exchange programs, or substitution treatment in prison facilities, just to mention a few. In particular, the situation in prison settings was also touched upon this year's World Drug Report, which was published just last Wednesday, as we heard already. And apart from facilitating safe and well-accessible intervention services in prison settings, we also need to think of securing equally important services being provided after prison release. Generally, it's of utmost importance to offer a broad range of diversified intervention services for all population groups, including low-threshold services, easily accessible not only but also for vulnerable groups. We are here today to take advantage to have so many professionals and experts present in order to engage further and share our experiences and practices in prevention, treatment, risk and harm reduction, as well as rehabilitation. Apart from this very intense conference program, I do hope that you also have the chance to enjoy Vienna. Given the extremely hot and sunny weather, I advise you not to miss a visit to one of our many Heurigen, the so-called wine houses, in the vineyards, or go to a beer garden. With that said, I wish you fruitful discussions and a successful course of this conference. Thank you for your attention.
Thank you very much. We'll now have a short interlude and enjoy once again the music from the orchestra, and then we will continue our welcoming ceremony. Thank you very much. That was beautiful.